Evening, ladies and gentlemen. This is Eric Lamar, your host of A Whole New Me Show. And tonight, tell you what, I've been looking forward to this particular episode for a couple of weeks, and glad you've joined us. And if you're catching this as the replay, please enjoy the show, watch it to its entirety. Tonight, we're going to be discussing some things that are very, very important. As you know, the Whole New Me project is a project that is about, personally, my transformation on my journey to becoming a new person with losing weight and so forth. And so what I want you to make sure you understand is the environment in which you are watching this. If you're watching on your Facebook page or on your mobile device or whatever, there is a share button right up above the video where you're watching. Please tweet this out, reshare it on your Google Plus accounts and inside of Facebook, because we like to invite anyone you know and care about that is struggling with the area of weight loss. Have them jump in and just get on the bus. Get on the bus with us, because we're having lots of fun. Basically, what I have done is assembled a medical team. I have a personal team of a chiropractor, a massage therapist, a doctor of Oriental medicine, which you are going to get to meet tonight. That's why I'm really excited. I have a mental therapy coach. I have my personal trainer. And these individuals are on my team because the approach that we're taking with this weight loss journey is a holistic approach. I'm quarterbacking my life. And so I bring these people on to my team because using their services helps me maximize not only my workouts, but we're going to deal with pain, some of the pain associated with working out. The chiropractor keeps me very strong because of my joints and everything are lined up, and my workouts are just off the chain. And then tonight we're going to talk about a procedure that my doctor of Oriental medicine did with me. I'm going to let her explain that. Below the videos, let me explain the page that you're watching this on. You'll see the broadcast where we're going to be talking tonight. There is also a broadcast that's pre-recorded of the kickoff show, and you get to meet most of my team that I'm working with. Then beneath that are videos of different segments of different ones that I've been able to live stream or record if the situation allowed it. So you get to see the work that these individuals are doing with me. So below that, there's a comment stream. Throw your questions in there as well. If you have questions, we can answer those questions tonight. And if you are watching this as a replay, you'll get to put your questions in and we'll be able to address those questions because the notification comes up inside of Facebook. So that's about it for all of the introductions. Let's get into tonight's program, because we're not just going to talk about me. We're going to talk about me just very briefly. Tonight is for the ladies. And in the studio tonight, I've got a lot of people outside the studio that are just having a lot of fun. So this is going to be fun tonight. I want to introduce everyone to Dr. Denicia Hilton. She is an amazing doctor of Oriental medicine, very passionate about what she does. And so, Dr. Hilton, I want to welcome you to the Whole New Me show tonight. How are you doing?
Hey, good. Doing really good. Fresh off of volunteering for a few hours today.
Fresh off of volunteering? What were you volunteering today?
Yeah. I'm actually a member of the Junior League of Clearwater, Dunedin. So today was the last day of our Art Harvest, which is our signature fundraising event. So it took a lot of hands to make sure the whole thing worked out and everything. So we got to take a part of that this weekend.
Very nice. It's good to have professional experts like yourself who give back to the community, and I'm sure that's very rewarding for you.
Yes. That's awesome.
Talk to us a little bit about becoming a doctor of Oriental medicine. What inspired that drive for you to want to become a doctor of Oriental medicine?
I will say it was a blend of growing up wanting to just be involved in medicine and in patients in general, mixed with how am I going to give back? How do I help others? And it took a conversation with a friend of mine who actually took what I thought was the only way to treat patients and introduced me to Oriental medicine. Granted, I had to make the choice. And the reason why I went this route was because you get to bring someone in and you get to learn more about them because you're able to spend much more time with them. You're able to work with their body, work with the energies of their body, work with them mentally, emotionally, and you get to really see these changes while you're sitting right there in your office. So that really inspired me because I mean, what other profession can you really sit there and work with someone? There's very few that you can have the time to really work with someone and really understand what their goals are, help them get there, but then not just symptomatically get relief, but prevention. So it's like, whoa.
That's powerful what you say there as far as prevention, because in a Western society that we live in here in the United States, and if you're watching this and you live here in the US, you'll understand what I mean by Western society. But if you're watching this from an international scope of things, you can relate to what Dr. Hilton is saying. In our society, it's not the commonplace practice to try to prevent various things. And the way you say that is very powerful. If we could think about preventing rather than reacting or treating, man, we could have longer lifespans or longevity like a lot of Asian cultures have.
Right. And the interesting thing is it's not just Asian cultures, but like, especially in Europe, a lot of their system is built in to prevent chronic disease. Why? Because they realize, hey, it's more economically feasible for us to put these things in place to support not getting sick or not having the chronic diseases than our system being bogged down with treating people for hypertension, treating people for diabetes and whatnot. So it's built in these other societies all around the world. And for us, communities are starting to see that. And so from the community standpoint, they're really starting to build that. So whether that be people living more in a community type environment, and they're having community gardens, to basically garden their own food and harvest, but they're working together. Everything's kind of right around them so they can walk and whatnot to go get their everyday needs, versus the being so spread out and everybody living way out here and out there, and then the cars and not necessarily the exercising and whatnot. So we're starting to do that here in some places. We're definitely starting to do so. But the other cultures, for sure, that is their mindset is, hey, we're gonna pay for it now, so that way we're not paying like exponentially more later.
Well, that's good insight to have as we set the tone for what we're talking about tonight. Again, just want to welcome everyone to the A Whole New Me show. Tonight, our focus is going to be talking about women's health, and we're going to briefly talk about at the end just some of the things that Dr. Hilton has done for me to help my journey, and I'll give you all an update of what's going on with me and so forth. As you're watching, again, if you scroll all the way down underneath the video, if you have a question for Dr. Hilton, go ahead and type that into the comment feed below. You're watching this inside of your Facebook page. There's a share button. If you find that this is an important topic as we get into dealing with some of the issues of women's health, please share this out with some of your friends, tweet it, send it out on Google+, Facebook, whatever you have to do. This is a topic tonight that is going to be raw, uncut, and for me, a first time publicly discussing. And because I know there's a lot of women that follow the show, and I appreciate and love each and every one of your support for what I'm doing. Again, as you know me, I am the founder and owner of My Hangout Academy, and producing web shows and live broadcasts. This is what we do. But this particular show, this is our give back to the community, because we want to help and encourage and inspire all those that want to live really, really happy and healthy. So tonight we're going to be talking about how Oriental medicine can affect women's health. Your particular clinic, first of all, where are you located, so that individuals can connect with you and so forth?
So I am in the Tampa Bay area in a little town called Safety Harbor. And Safety Harbor is actually right in between Tampa and Clearwater. The address is 405 2nd Street South, Suite A in Safety Harbor. Again, it's 405 2nd Street South, Suite A in Safety Harbor, and that's in Florida, by the way. And like I said, if you're coming from Tampa and you're driving across the bridge, which is a gorgeous setting, by the way, if you get to Clearwater, you pass Safety Harbor. That's how close it is to the bay, like right there on the water.
It's not far from the Courtney Campbell actual causeway. So as you're coming in from Tampa, you want to come out on the Courtney Campbell Causeway. So that's the location. Again, Dr. Hilton is my personal doctor, and I receive acupuncture treatments from her. And we're going to get into one of those treatments that was very interesting within this last month that we've been able to get on the show and talk. But as it relates to women's health, what are some of the things specifically that your clinic is doing that's revolutionizing what's going on in women's health, or at least introducing to our communities?
Yeah, I would say that it's definitely been around within the medicine for a really long time. It's new to our society, and as far as for women, this is an option. So what I really focus on a lot, and I enjoy treating so much, is actually giving women that freedom back from feeling like they're tied and shackled down by their menstrual cycle. Tied and shackled down in the sense that they are missing work, they're being unproductive at work. Same thing at school, because they're in so much pain. There might be too heavy of a flow, or maybe it's even unpredictable. And that is usually coming from Western diagnosed diseases such as pelvic pain, fibroids, polycystic ovarian syndrome, endometriosis, dysmenorrhea, which is painful periods. And so all of those have their different diagnoses and symptoms. But with Oriental medicine, we have the tools to be able to give women some relief from those, and even certain expectations. So it may have been something that's completely irregular, like, oh, it's 42 days in between here, but then it's 25 over here. Let's try to get that down so that it is regulated. And it's not just even about the cycle. For women, things are all surrounded around the cycle. For our life, I mean, it's women are planning their trips. They're getting married. They're like, oh, sugar nuggets, I'm getting married. This is what's happening. I'm already in a lot of pain wanting to be around the toilet because I'm vomiting. And that's what I mean when I say that we want to give you your life back, and where it should be at ease. Should not have any issues with your menstrual cycle. And that's what I enjoy doing and treating, for sure.
Okay, so let's pause just for a quick second. I want to go back and recap some of those issues. You said, number one, the issues that women are having are dealing with painful, irregular, or periods that are coming just unscheduled, that just cannot get regularity to them. Okay. And part of what you're focused on giving this freedom back is because women experience unproductiveness at work during their cycles. It can be very painful, so they're not fully being able to be who they are and give what they give to society.
Correct.
Or to their jobs and so forth. Okay.
And even to those who may not be at work or at school, but even to their families. There's not much that they can give because it's just so debilitating, really.
Yeah, and so, and I'm glad to be able to do this because I think oftentimes a lot of men, we could be very insensitive to this topic, although I don't have a woman in my daily life that I have to look out for with this situation, but I do have women that are on my team, women that help me when it comes to being productive in my business and so forth. So being able to be understanding with this situation is just not their fault. It's just not a PMS issue, is what my mind is telling me we need to be thinking about.
Right. And I mean, for sure, a lot of it is it's definitely society. And one of the first things for men, I believe, is it's the whole ill factor that needs to just go away. I mean, it's something that's here to stay. You got to just get over it. And
it's been around for a long time. It's not going anywhere.
yeah, exactly. Like, oh, Eric, nice meeting you. You were born out of a menstrual cycle. Like, I mean, that's really what it is you're born out of a menstrual cycle. And yeah, I mean,
well, thanks for that revelation, Dr. Hilton.
I'm just saying, it's everyone, right? Like, but I mean, guys for sure can be extreme. You can definitely have more sensitivity to it for the woman that's in your life. And it could be your mom, it could be your sister, it could be cousins, god sisters, your daughter. All of these women are going to experience this. And so creating an atmosphere that is hostile or shameful for a woman, or even saying, not even saying, oh, I don't understand what you're going through, but I want to help. You know what I mean? Like, not even getting to that point, or even just setting the tone of, why is she complaining about this? And so for a woman, then having that type of environment, that means she doesn't have support. She doesn't even have support in her own home. And there's a lot of women going around that are even going to their physicians. So they're already going to their physicians. They're already going to the hospitals with this pain that somebody else is telling them is not real. But it is very much so real. And so by starting, especially amongst other women, because there's even shame placed between women. Like, oh, just because I don't have painful cycle, I don't know what she's talking about. She's just weak. But that's why we need to build this culture of really accepting it, and that there is this possibility that women are going through this. And it can come from both sexes for sure, that we can provide that support.
So we want to make sure we understand that this pain is real. It's not something that is being put on and so forth. So we definitely, as a culture, as men, we want to be very, very supportive of the situation. Now, there are things that I'm sure we could do at homes and so forth and in our interaction. But more specifically, what then, if we recommend that our significant other or our sister or our mother or grandmother, whomever, connect with you, what are some of the things that you will start introducing to them? And what are some of the things that your patients have done with you, or you've done with your patients, to give them relief during this time, or at least set it up to where this becomes a less painful time for them? I know that was a multiple series of questions there, but I would like to get it to see what you can offer for women to get relief with this issue.
Right. So I bring up family, I bring up society, because I do practice holistically. So yes, I'm going to ask those questions because I need to get an idea of who is around her, right? What type of support is there? Because if there is support, then she will have the motivation and the encouragement to continue her treatments even with me. Okay. And now she's coming into my office, and actually you may not even need to come into my office. You can actually give me a call and we can do herbal consultations over the phone, do all of the assessments that are needed, and actually get a formula to you. And we do follow-ups, right? So now we take the woman who wants to come in. The assessment is going to be very, very detailed, because I'm wanting to know when did your cycle start? What was it like after you've had your cycle for like a year? How many days in between? How long is your cycle? What's the flow like? What color is it? Is there clotting? Is there pain? I mean, all of these different pieces of information. And what's so beautiful about the menstrual cycle is that although we might be treating just the menstrual cycle, there are actually other diseases that can be corrected, and imbalances that can be corrected just by regulating the menstrual cycle. And so that actually gives us a lot more information just by knowing how our cycle is, to even help all these other issues. So that's a barrage of questions that we'll go into. And I want to have a measurement of how does this impact her life if she is missing work, or if she is feeling embarrassed because she's having to go check every half an hour or every hour to make sure she doesn't have an accident. What are some measurements that we can take and assess and have our baseline, if you will? And then once she comes in regularly for acupuncture, if she and herbs will be given. Herbs definitely complement and really, really work very, very well. Then we'll do that. For some, it would be a formula that is already in existence, known as a patent formula. For others, this tends to be the route that I tend to go because every woman is different. I usually use a customized formula. So I build that based on the diagnosis that I would come to for her particular cycle. And one of the key things that is not just with this, but with any type of complementary medicine in general, is that it takes consistency. So you would have to understand that you didn't just have a cycle that started like this, right? We're going to be working kind of backwards and regulating. Now, I'm comfortable to say that most women that come in and about the third cycle after intervention, we can really see that there's some regularity that's there. And most of the time, high percentage, 90% by that first cycle after we would have done the intervention, then she would have noticed a difference in discomfort during that cycle. And then it just gets better from there.
That's a huge success rate to get 90% to experience relief from the discomfort. That's super encouraging. Again, if you know someone, I would say get them on the phone right now. Blow up her phone line, because I mean, as I've casually talked to, a lot of my clients who are women, some of my friends, this is a topic that I find that, again, as a man, personally, I will never understand what any of you women are going through. I just will not ever understand that. But I can also redirect, and I can appreciate where I can support. Mm-hmm. And so this has been a topic that's been received as I talk to friends. I was out last weekend with a friend and her mom, and she was like, "Mom, you got to hear about this doctor that he goes to and some of the things that she does." So there's such a big interest. And so,
well, yeah, I mean, it's different, especially when it's coming from you, because you're a guy and you actually legitimately feel like, oh my gosh, women need to know you're not making fun. And so then that's just encouraging, because to women, it's like, oh my gosh, there's a guy who actually wants to help us out. Shut the front door. And so it's a big difference. It really is a big difference.
Well, I mean, if we look at it, I mean, it's a win-win-win for everyone. Your business helps women. When women get relief from your services, the kids respond differently. The husband will respond differently. Just a win all the way around.
It really is. It's like, I tell people everything revolves around the menstrual cycle, and they think I'm joking, but I'm being serious. Everything revolves around it, because yes, the kids and the partners. Like, I just spoke with a guy this weekend. He's like, one of the officers I was volunteering with, he goes, I swear, I think hers comes like twice a month. But he's talking about his wife because of how she reacts. And so I'm like, she needs to call me if you really think so.
Is this where the saying, if mama ain't happy, ain't nobody happy? Is this where it started from?
This is one. Yeah, this is definitely one piece for sure. For sure.
Yeah, so we want all moms out there to be happy. I mean, definitely, if you would put that in my chat between you and I want to copy it into the comment stream for everyone to be able to connect with you. Give me your, again, the address and the phone number that people need to connect with you. I know there's another, as you're doing that, there's another amazing topic that you brought up to me that I've been sharing with a few women that I encounter. We've got a couple minutes. We've got a couple minutes left for this segment that I want to get into, but I've been sharing it with women, and some have never heard of it. By the way, talk about your podcast, and so that people can follow you and what you're doing. But this topic I found was very, very intriguing. Of vaginal steaming, and I was like, I've never ever heard of that. And then you explained it to me. I want you to explain it to our audience that's listening and what some of these benefits are.
Okay, awesome. So I love vaginal steaming. And vaginal steaming is just what it sounds, right? However, the practitioner that I enjoy going to practices what is called the womb sauna, is where she got her training from. But the process it's an elaborate process. There is an understanding that as women, we hold a lot. So in Oriental medicine, we talk about your mental and emotional things that are going on because our bodies hold on to that as messages. And so my role is to talk to you and get an understanding of how is your body holding on to the mental emotional aspect of things, right? And for a lot of women, that happens in the womb, in the uterus, the fallopian tubes, the ovaries, right? And so that's where we find a lot of like those tumor-like things that are growing. And then we have the painful periods, there's infertility, there's all of these different things. And so what vaginal steaming is, it's a process of just of almost going internal a bit and identifying where there might be something that's not really flowing very well for you. And it's manifesting itself through the menstrual cycle disorders and irregularities. And so you are guided through a meditation, through some yoga practice to open up the hips and to open up that area. And then you're going to sit down on your throne, basically. I mean, you're this queen and you should be treated as such. And there are some herbs and herbal blend that's boiled, and there's the steam. And as you sit there, as steam goes up and carries the essences of the herbs into the up through the vagina, and then it goes up through the cervix and into the uterus. And from that, I will say that my first experience, there was a difference in my cycle the very next cycle.
Wow.
Yeah, according to, it really is. It's great stuff. And vaginal steaming is something it's not new. It's comes from different areas. Nobody really knows exactly when it started or where it started, but it's practiced in South America and Mexico. There's the Aztec type, the Mayan type. It comes from all the more of the indigenous, if people want to call them that. I don't like that term, but anyways, the more native type of cultures. And because in their culture, it is celebrated to have the menstrual cycle. It is very important. There's a lot that can happen. For women, we are given something that is extremely powerful and an opportunity that men don't have, which is that things can happen in our body, but this is something that happens every month that we can get rid of gunk. Right? Get rid of some of the junk. It happens, right? And it's a sense of renewal every cycle. So when you are in pain, under those auspices of those cultures, that means that you are having difficulty expelling. You're having difficulty getting rid of that gunk. And by doing the steam, it helps give that uterus that nourishment that it needs. It warms up the uterus so that it doesn't have to work as hard. That's where the cramping is coming from, is the uterine contractions are just like, when it should be more of a smooth flow and it should not be painful.
Well, let me interrupt just real quick because you shared that with me and I thought I had never heard that before. Repeat that for our listeners. Where does the pain and cramps from menstrual cycles come from again?
That mostly and mainly comes from the uterus. All of the lining that's inside of the uterus is like a little pear shape like this. And so the purpose of the menstrual cycle is that lining that grows inside to be prepared for conception. But if there is not a pregnancy, that lining needs to actually expel from the body. So that's the cycle. But the cramping comes from trying to push the lining out. So if there's a lot of pain in that area, it's like cramp, cramp, cramp. Now there are some illnesses that the feeling of a cramp can actually come from the ovary. Some women are very sensitive to when a follicle from the ovary is released, and they can feel that. So it's usually on one side, right? Some women who have endometriosis, those cells that should be inside the uterus are actually in other areas of the abdomen, and sometimes even to the lungs. So she might even feel with each cycle, she might even feel pain just like what feels like it's in her stomach or her intestines. And that's really coming from the cells that should be in the uterus, but they're in other areas. But most of the time, if you don't have that, if you don't have endometriosis, that pain is usually coming from that uterus having to work really, really hard to get the endometrial lining out of the body.
Wow, that's very interesting. I don't know if I've never heard that explained. So obviously I've never had it done, but I don't know how many women really, really understand. When I was married, never understood that. So that's very good to know. I hope a lot of people get value out of that. So continue on then with this process with the vaginal steaming and those benefits of what it accomplishes.
Yeah, so there have been benefits of decrease in pain during your cycle, helping to regulate your cycle, helping with fertility, and also some women use it as a meditation as well. So it's even a stress reliever to her. The primary reasons is definitely to help with the regulation, and then also the pain relief associated with the menstrual cycle, for sure. And it would be something that for some women, it might just take one steaming. For others, it could take maybe once a month, and it's not like it's once a month for a really long time. Usually it might be like 3 months maybe, and then it gets to a point where you can elongate. So at this point, like I said, for myself, mine was seen in like that by that very next cycle, which was within the next week. And then I can go back in for a 6-month maintenance. Another great time to use it is for women who would have just had a baby. So that baby was housed in this uterus, and the uterus is starting to get back into its shape, and it's needing to rejuvenate itself, if you will. And so therefore she can use the steaming to actually help continuing that cleaning out process from the placenta coming out, baby coming out, and everything. So it's even helping in her own postpartum healing by doing the steaming.
That's amazing. I tell you, that just what's available that oftentimes is not discussed in our culture, in our society. Just because it's not discussed in our society doesn't mean that it's not good or it's not available when other societies are benefiting.
Exactly. Yeah. And I mean, and that's the beauty of like the internet, for sure, because now is an opportunity that you might be able to learn from these other cultures and bring that back to your own community, to be able to share that with other women. And I feel like that's exactly kind of what it is that I'm doing. And the Sisters of Flow, which is the name of the podcast. However, that is actually a community. So it is a community of women building it so that women can find like their home and find their peace. And it's centered around menstrual cycles. But it's provided there, like I said, as a community, to find another woman to talk to, that you might yourself have some issues. Let's see what other options are coming out, what studies are coming out, what treatment options are there. So that is there. The Sisters of Flow podcast is a conversational edutainment piece. We are definitely talking about some off-the-wall things. Vaginal steaming is one. Vaginal Steaming Part 2 actually just came out this past Friday.
So definitely, since you mentioned that, you've got Part 1 and Part 2 of Vaginal Steaming.
Yeah.
Go to iTunes or Stitcher, but iTunes, and pull up Sisters of Flow. SoundCloud is another that you can go to. So you can go to SoundCloud, Stitcher, iTunes, look up Sisters of Flow, and you want to follow that podcast, and you can hear that. hear
You can
that
even
podcast.
search, if you forget either one of those platforms, you can always just search for Sisters of Flow on Facebook, and we're right there as well. But that's definitely, we talk about all different treatment options. And then we even talked about the flask fake tampon. And I was like, what is this fake tampon that they're talking about?
Well, and speaking of along that line of the fake tampon, not so much that is fake, but when I listened to the very first podcast that came out of Sisters of Flow, you were talking about the menstruation cup. And so I was sharing that with some friends, and they couldn't believe it. I mean, you would think I don't want to be the expert on this, but I learned so much from listening to the podcast that it communicates right with your smartphone to let you know when the cup is almost full.
Yes.
I was like,
oh my gosh.
Here.
Yeah. On that first, like, menstrual cups have actually been around for decades. But see, most women are not introduced to that. They're used to the commercials that come out with pads or tampons. Like, those seem like they're the only options. But there's the cup, the menstrual cup. And then that group that they have I think it's an Indiegogo. I mean, you can go and listen to it on the first episode, that they want to bring this smart menstrual cup out the first, like, around the beginning of next year. And yeah, it's linked to an app letting you know, like, hey, you probably need to check this and you might want to change it, which is a problem for using the menstrual cup. So it's like they see this problem with using the menstrual cup, and then they're like, oh, but we have this. And so I said,
that's wild. Well, I tell you, I want to get into real briefly into this last segment. Just want to talk about some things that you've done with me, and I really want to appreciate our listening audience that have joined us tonight, and you for coming on with your expertise as well. Again, this is Eric Lamar, your host of A Whole New Me show. I'm joined by Dr. Denicia Hilton, Doctor of Oriental Medicine at Hilton Holistic Healthcare in Safety Harbor. The address is 402 2nd Street South, Suite A in Safety Harbor, Florida. Inside the comments below the videos, you will see her information that's posted. You can copy that. We did not get your phone number. Throw me your phone number, and I will put that into the chat as well, so that our listeners can connect with you. We're talking about how Oriental medicine can affect women's health. If you've been listening, we've talked about some amazing things that can affect women, understanding the culture, the environment, the support system. And these are some of the things that Dr. Hilton does with her patients. And then when it's time to introduce herbs, those can be introduced either through a herbal formulation through the mouth or through vaginal steaming, and then her acupuncture treatments for helping with pain and so forth. Don't fight this issue. Realize that there are support, and please share with all your other girlfriends out there, because this is something that each of you deal with each and every month. And so when you can get relief from this, from what I'm understanding, from how I've been educated from Dr. Hilton, productivity can increase. You may not miss days of work. Your relationship with inside of your family can definitely increase. So there are so many benefits of connecting with Dr. Hilton and what she's doing at her clinic and so forth. Any last comment that you want to say regarding the Sisters of Flow project and so forth before we get into talking about some things that you have done for me?
Yeah, I encourage everyone to go check out Sisters of Flow, like I said, on the podcast and also on Facebook, and be on the lookout for a call for submissions. So I'm actually putting out the word that I want to get stories from women all over the world about your experience, your interpretation of your menstrual cycle. It can be as serious or as funny as you want, and in the form of poems, essays, and also even if it's art. I'm putting together a book, and that book in a whole is meant to be shared so that another woman who reads it feels like she's not alone in what it is that she's experiencing. And then also inspirational. And it's something that can be even given to the young girls as they're starting, for sure, to educate them, not to scare them, but to educate them that if they start to feel like this, then something's not quite right. And so she will seek help sooner than the other women that might have been experiencing this for so long, and at the last minute, they're told they need to have a radical hysterectomy. So that call for submission is actually going to be posted on sistersoflow.com. I'm going to post that up tonight, and looking for submissions until January 31st.
Outstanding. I mean, that's very powerful. I mean, there's probably so many diagnoses that are happening out there. People are having surgeries that may not need those surgeries, which creates more pain and discomfort and addictions to pain. I mean, et cetera, et cetera, et cetera. Wow,
Right.
That's powerful. Thank you so much, number one, for having the passion that you do around this particular subject matter and just who you are. And I'll just give a personal testimony. Whenever I go, we have a lot of fun and is educational. And I want to talk about a treatment that you did for me a couple of weeks ago. And you had noticed that one of my legs was just appearing to be a little, well, not appearing, but was a little bit longer than the other leg. And I've been having some severe back issues and so forth. Tell me about that treatment, what you called it, and just real briefly, what you did for me, and then I will go into explaining how I felt afterwards.
Okay. All right. So briefly, just like you said, one leg was longer than the other, and the treatment is named just that. It's a long leg treatment. And it was actually put together by the founder of my school, of Dragon Rises College of Oriental Medicine. And he compiled basically information.
Say that one more time. You broke up. You broke up. We lost you just for a second. The name of that treatment was what again?
The long leg treatment. So one leg being longer than the other leg. And I would use that treatment. Can you hear me?
We get her to get back on here real briefly. Are you there?
Oh, I hear you now.
Okay. All right. You had broken up, and I kind of took over and said the name of the treatment because we didn't hear that from you.
Oh,
but it's
okay.
the longer leg treatment. Go ahead.
Yep. So it's a long leg treatment, and it was put together. It was a protocol put together by the founder of my school, which is Dragon Rises College of Oriental Medicine. Dr. Leon Hammer put it together, and it's a 3-step process that involves assessing the leg length side to side. And he took acupuncture points and also a little bit of information from chiropractic, but then also information from his teacher. So he put it all together to formulate this protocol. And when someone's one leg is longer than the other, there is oftentimes one side is compensating for the other side. And that can lend to pain coming in the hip, or it can come in the back. And also, if you look at it on a mental, emotional side, if you think about you feeling imbalanced, like you physically are imbalanced, but you can even mentally feel imbalanced. And so by correcting that leg length, and it involves points like up here and then points along the one side, and you have the video of where I put those points at. Usually you're using electrical stimulation, so you're connecting the electrodes to the acupuncture needles, and they flow in a direction that Dr. Hammer has said this is how it usually works. So I just connect all of those, and then the patient would sit there for a while. In my first experience, I was, because it is a long treatment, I was sitting there, and then I kind of felt myself kind of go to sleep, and all of a sudden I felt my hip just go click, like boom, boom. And I was like, what was that? But when I stood up, I was like, holy guacamole. Like, it was no problem. I just felt like this, both feet planted. And I mean, it was amazing. It felt great. My back pain was gone. So that was really, really awesome. So that was something that I did notice with you when you were talking about the back pain. And so that's why I did that for yourself.
And I would like to say thank you very much for doing that. And because after we got done, when I stood down on the floor, as to what you were saying, it felt a even pressure on my legs, on my feet, first of all, that foundation, stability. And that's part of why I talk about why I have a team. And I appreciate Dr. Hilton being a part of that team, because when I train with Chandra V, I could experience soreness from training as our training intensifies. The acupuncture helps with the soreness, the massage helps with that, and the chiropractic, getting alignment complements the acupuncture as well.
Right.
And I have recently moved to a different chiropractic clinic, and the strength that I'm experiencing in my body is tremendous. So a combination of all these things has been such a blessing in my life. And this is why I want to make sure that the world and everyone in the Tampa area, Clearwater, St. Pete, knows about these local resources that you can connect with. And Dr. Hilton is one of those. And if you're away from Tampa and you're listening in our national audience, it will be worth the trip coming in. And as she said, some of this is phone consultation.
Yeah.
She doesn't have to actually put her wonderful hands on you and her needles inside of you, but she can really help you with some things away. So don't hesitate to connect up with her. So Dr. Hilton, again, I want to thank you for coming on, sharing the wonderful things that you're doing for men and women, children, and just loving your patients the way that you do.
Thank you so much. Especially for having me. So I really appreciate it.
Just a last real quick recap. When Chandra V and I did a check-in at my 35-day point into this process, I was down 6 pounds, which I'm now down 10 pounds into the journey, but down 15 inches in different measurements overall, and 5% body fat reduction. So yes.
That's amazing.
Kool-Aid is out of my life. MSG is out of my life. I don't participate anymore.
It's a big step for you.
Yes, pork chops are still there, but they're on a limited basis.
Moderation is key.
Yes, moderation is key. However, I really have included more of a pescatarian diet, which is more fish. So I'm back at my club, at the Center Club, where I'm a member, and I get to eat a lot of fish. And this week I've incorporated some chicken salads, which have been really, really good. So I'm excited to check in on Tuesday and to see what my progress was over this past week. But I'm super excited just about my workouts. Workouts have been really, really fun. I've been able to get through them. Let's see, I better be careful how I say this, because I'm sure Chandra is watching.
I was going to say.
Chandra's going to be watching.
We need to step it up a notch, Chandra.
The combination of everything is giving me confidence.
Chandra, step it up.
It's giving me confidence. Yes. So the minute I think about, man, she needs to step it up, I say, shut up, be patient. She's got this. And Lord, does she step it up? So I'm not saying that. But no, I enjoy being pushed. I had, last week I had an experience, and then we're going to wrap this up. I had a real amazing experience last week. I felt just extremely good. My energy level was super high. I overslept one day. I missed a training with Chandra because I had went to a chiropractor that had adjusted my feet, adjusted my ankles, adjusted my back and neck. And I felt like going out playing football. Now, I didn't do that. But I also wanted to go to the basketball court and just play basketball. I had not felt so alive. And I was telling a friend, and I really haven't shared this with a lot of people, but I had some issues that came up early on in this transformation process. And again, since this is all being documented, I don't mind sharing it on video. I had a couple of episodes where I had some dizzy spells that I got really, really scared. And I've shared it with my doctors that aren't a part of my team. So I'm fine. So I don't want anybody to worry, but we're past this now. And it was really concerning to me. And to be honest, because my health situation just was not where it needed to be, I really was afraid to go to sleep. This journey to become a whole new me is very, very important. I need to maintain my health and get my health better. And so we're on that path. But I was afraid. And so over the last few weeks, I'm getting stronger and I'm feeling much more energetic and I'm sleeping better. And because of all the things that are working together holistically. And so I don't have those fears anymore. My blood pressure was just out of control, even with medication, because my body was in pain. And so we've gotten the pain under control and the body is working better together. And so I feel great. And I'm just excited to even feel greater within, the next few weeks. I'm excited to see what that brings as well. So again, I just want to thank you for being who you are and your contribution. And please, if what Dr. Hilton was talking about tonight makes sense, and if you have further questions, please don't ask me those questions. Ask her. Because if you're a woman or if you have a woman in your life, all I'm going to say is go see Dr. Hilton. I am not qualified to help you with that, but I can definitely get you to the best hands to give you that support. So
thank you.
Anything else that you would like to say before we close this up?
I will say one thing that I often get a lot is, can acupuncture Oriental medicine treat XYZ? And I will say, and just ask the question, and I can let you know, because it can treat so much that it's really hard to get into all of it when you're sitting down with somebody for an hour. But if you do have any questions, even if it's not related to female reproductive cycle, but it could be anything else, digestion, headaches, migraines, colds, flus, and more than that, then please definitely reach out and ask, because at least you'll have that answer and then we could figure something out.
Outstanding. Well, again, you're watching this. If you're watching live, feel free to go all the way down to the bottom. There's a comment feed. You'll see comments where I've posted Dr. Hilton's contact information, her office and clinic address, her website, email address, and connect up with her. You'll also see videos of some of my other team members. If you're wanting the best workout trainer in the Tampa Bay area, I recommend no one other than Chandra V. And also Lauren Matos, again, who is my mental therapy counselor. We talk about food addictions. We talk about other issues related to, again, this journey of becoming a whole new me. And anything that becomes an obstacle that's up here that goes way back. We've dealt with some issues that was like, why do I act like this as an adult? Well, many of us, it has triggers that go all the way back to our childhood. She helps deal with that. My massage therapist, Diana Brothers. I'm working with what I feel. Obviously, I'm going to be biased. I feel I have the best people in the Tampa Bay area that I'm privileged to have helping my body recover and become a whole new me. So I encourage you to work with these individuals as well. Dr. Hilton, it's been great having you on tonight. This has been an outstanding show. And ladies, please don't let the pain, don't let these issues hold you down. Go get relief today. Connect with Dr. Hilton.
Yes.
Connect with her and check out some of these other options that are available. Don't medicate yourself. Again, I'm not here to tell you what to do, but drugs and pain medicine, there are other alternatives to that.
Yeah.
That could be very much more healthier to your body.
Definitely. Thank you, Eric, so much. Appreciate
You're absolutely
it.
welcome. And again, this is, if you find this to be valuable, please share this with other individuals. Click up above, share it out, tweet it out, put it out on your Google accounts, Facebook. We appreciate the support and help others become a whole new them. This is Eric Lamar, your host of A Whole New Me Show, and I want to thank you for your attention tonight. and we'll see you at our next episode.
Good night.